Welcome to the office. Hi, Cynthia.
Hi.
Welcome back.
It's good to be back.
So, what's up? We've been on an interesting journey, you and I, haven't we? Well, actually, more you.
Yeah.
And
It's been 8 months now.
you've been seeing me for 8 months.
Yeah.
3 times a week? No, I'm joking.
No.
No. Tell me, we started 8 months ago.
Yeah, January.
What did you come for?
I was having issues down my left side.
Okay.
It was difficult to walk on a just significant length. I would get like really sore and I couldn't walk for a couple of days. I would be limping afterwards.
Okay.
But now, since everything's sort of reset, or this side's turned into my weak side at the moment, while this one's getting stronger. And I feel dropped some weight and just feeling stronger.
So, biggest change since you've been coming? The biggest change? Movement?
The biggest change, yeah, that I can move easily, get 10,000 steps and more, and some days are better than others.
Sure.
Have things coming and going.
Okay.
But I feel like a lot stronger, down about 40 pounds,
And you changed your diet, you went on some big programs, or just you're able to move better and eat cleaner?
Eat cleaner, yeah, like the inflammation in my body's reducing everywhere.
Cool. So 40 pounds in 8 months?
Yeah.
Naturally. That's pretty cool.
Yeah.
Yeah.
No gluten and sugar, I think, were the biggest keys, really. Yeah.
They need to know that. So, where are you today, overall?
I think I just have to keep doing what I've been doing. Everything it's working. It's just going to take a little more time till I get to my goals,
Okay.
And I think that as far as my spine goes, I have so much more movement in many different places. Like energy that was really, really stuck is now moving and flowing properly, especially across my whole back, and that gives you energy kind of everywhere in your body, really.
Absolutely.
But you don't realize it till it's restored,
It's pretty cool. It's good. It's a good way to put it. And when you're in something, it's just like when you're in a bad situation, or it appears to be a bad situation. You don't see it until you step outside of it. So people can be in certain situations in their life, whether it's physical, mental, spiritual, emotional, whatever it is. And when you're in it, you don't see it. Sometimes you have to step outside of it. And in terms of the spine, when it's subluxated, when there's pressure, when we're off and we've compensated, we don't realize that it could be better.
Yeah.
Does that make sense?
Yeah, you start living with the pain and you get used to it. And until you start to ease that pain in some way, you don't even realize you've been living with it.
And how do you ease that pain? How are people easing the pain?
I guess
Generally.
Pills, whatever they take, For me, I think that when I was in those states, I just slept a lot extra, to avoid the pain.
Right.
But I have whole new patterns with everything now.
That's awesome.
Yeah.
You ready?
The things I wanted, they were all things that I wanted before I started seeing you, and it just became part of the package.
Love it.
Yeah.
That's awesome. Okay. You ready to get started?
Yeah.
Let's do it. Let's see where we're at.
I had a little bit of pain going on in this foot this week, sort of in this area. It feels pretty good right now.
Okay.
But it limited my walking a couple days.
Okay.
Like electrical energy going through it or something.
We'll take a look. Let's see where we're at.
Otherwise, I felt pretty strong since I've seen you.
You've lost a lot of inflammation out of your body in these 8 months, really. And, when we look at even just scoping you and we compare to visit 1, look straight ahead, please. You're going to see how much easier and less inflammation there is. It's really cool. See 1 left side. Do. Mid back is good.
Yeah, remember I had a hump when I first came. It's we're starting to reduce too.
It's pretty cool. Even here, you can actually we can scroll this down. We were getting stuck right there. And now we're not. That's the best news. Right there, sacrum. Left side. Just a tiny. 10 points, 10 points. Penthouse in the basement, girl. Penthouse in the basement, and then we'll deal with the left foot, okay?
Okay.
You got it. Back slowly towards me. This is 5. This is S1.
A little.
S2 or S1?
I think S2.
S2, S3, S2, right there.
S2.
S2. Sit back for me, please. And this is now becoming more of a, we're fine-tuning along the way, right? It's kind of like, you know, it's a funny analogy I use about braces. First they do all this work in the beginning. Things are starting to shift, and then you have to fine-tune it to get that alignment. The difference is I'm not trying to straighten the spine, I'm trying to help keep things in balance. Make sense? Mm-hmm. We're trying to level the foundation and get some more curve in your neck. You ready for me? Mm-hmm. Cool. C1. There. Cool. That's the clunk. Beautiful. Nice. Let's walk that off once, please.
That's good. I was having a little bit of pain in that area this week. I kept icing it.
Face down. Came a long way. And the take-home message here is what? We got the process started.
Yeah.
Now, you just got to keep that process going.
Yeah. As far as like weight, I think I'm like a third where I would like to be.
Okay.
And I'm not sure as far as the spine goes. We just got to get it even.
We got to make sure that hip.
Foundation.
We got to make sure that hip is right. Hold on. All right. So let's focus on the tailbone, sacrum. I'm using the drop board to get a little more oomph. And we want to torque up, so we're going to torque it up this way. Cool. You good? Gotcha. Mariposa, the butterfly. Walk, please. Nice.
Yeah, I'd say like when I first started, I was stuck, and now I'm moving.
And it's not just the body, is it?
No, it's all kinds of ways. You know, I was stuck in my career. I was stuck in, you know,
Have a seat.
different ways.
Yeah, but they're not coming here for job advice.
No. But when you start to make one change, it like starts to change your whole life.
Yes, absolutely. I've had a lot of patients actually quit jobs, change careers, because after getting their nerve pressure and their body back in balance, they realized they weren't just stuck in their body, they were stuck in their situation. You know, and they're like, all right, we need to do something different.
Yeah, I like my jobs very much, but I like to do something different too.
All clear. Go on your back, please. You said it's more on the outside here?
Yeah.
That's cuboid.
Ooh.
That's talus. That's fibula. We have a medial talus.
Yeah, a little bit there, and then the first one.
All right. Medial talus. Relax the foot, please. Relax the toes. Let it go. Fibula. Calcaneus. Turn to your left side, please. Actually, turn to your right side.
Okay.
Yeah. And let's do a little more of that calcaneus. Relax the foot. Drop it down. Awesome. Come on up. Hips are moving good.
Yeah, it feels good.
Have a seat. Did good. I just want to recheck the neck. So what's the next part? What are the next set of goals over the next 6 months?
This is a lot of the same. Doing the same, staying on pattern, you know.
Ears. Right shoulder. Left shoulder.
Yeah, I think I'd be in a better place if I didn't have that fall in June. You know,
In the middle of the care, she had a pretty
had a little
pretty
bit of
nasty fall, so it took us a while to get out of that.
stepped on a little rock and took a tumble, and I had to do a little recovery.
One little rock can change it all, right?
It was very sharp, punctured up into my foot.
But I'm saying, how big was it?
Oh, it was very small.
This big?
Yeah. Like generally, it was a very small rock to cause all that drama. I feel that.
5, 4, 3, 2, 1. 5, 4, 3, 2, 1. 5, 4, 3, 2. I'm proud of you. You come a long way.
Yeah.
It's good.
It starts to make you feel like much stronger as a person, you know, by accomplishing it.
When there's less pain, but more importantly, when the body's moving. Because if the body's in balance, body's moving, there's less pain. Then there are other causes of pain. And so what happens is people think it's just pain, pain, pain. I've had patients come in, I have pain, and I'm checking and there's nothing to adjust. Where's the pain coming from? Some of them were inflammation. Some of them were psychosomatic. Some of them needed somatic work. Some of them needed therapy. They needed to go to a counselor.
Interesting.
Yeah, seriously. Some of them needed more movement. Some of them needed to detox. Some of them were drinking too much alcohol. Like, you know, everyone's got different things. If the
If I come to you a few years ago, alcohol could have been a problem, but not now.
Yeah, it's great. So the idea is first get the body balance, but then you also got to balance all that other stuff, right? Mm-hmm. It's really what it is.
Yeah, it really starts to change you internally too, as the external changes.
Exactly. And
It's
vice
coming
versa.
from the internal, really.
Mm-hmm. All comes
That they
from
start
within.
to affect each other.
And sometimes you can do the somatic work, working on the body, helping clear the mind too. Squeeze. Squeeze. My dear, you're all set with me.
Thank you.
You're very welcome.
Thank you for everything.
Okay.